Concentration, 1 mg per milliliter equal 1,000 dose, 2.5 mg max single dose, 2.5 mg dosing interval, n/a max number sign of doses, 1. What is the treatment for a patient with croup who is greater to or equal to 1-year-old to less than 8 years old via NEB? Weight, n/a concentration, 1 mg per milliliter dose, 5 mg max single dose, 5 mg dosing interval, n/a max number sign of doses, 1. What are the classifications of glucagon? Glucose elevating agent, insulin antagonist. What are the pharmacodynamics of glucagon? What is the onset of glucagon? 8 to 10 minutes approximately. What is the duration of glucagon? 19 to 32 minutes. What are the indications for hypoglycemia? Agitation, or altered LOA, or seizure, or symptoms of stroke. What are the conditions for glucagon in the hypoglycemia medical directive? Age, n/LOA, altered HR, n/RR, n/SBP, n/other, hypoglycemia. What are the contraindications for glucagon in the hypoglycemia medical directive? Allergy of sensitivity to glucagon, phenochromocystoma, which is a tumor of the medulla of the adrenal glands. What is the treatment for hypoglycemia with glucagon when a patient is less than 25 kilograms? Route, IM concentration, n/a dose, 0.5 mg max single dose, 0.5 mg dosing interval, 20 minutes max number sign of doses, 2. What is the treatment for hypoglycemia with glucagon when a patient is greater to or equal to 25 kilograms? Route, IM concentration, n/a dose, 1 mg max single dose, 1 mg dosing interval, 20 minutes max number sign of doses, 2. What are the indications for opioid toxicity medical directive? Altered LOC and respiratory depression and inability to adequately ventilate and suspected opioid overdose. What are the conditions for naloxone for opioid toxicity medical directive? Age, greater to or equal to 12 years LOC, altered HR, n/RR, less than 10 breaths per minute SBP, n/other, n/A. What are the contraindications for naloxone and opioid toxicity medical directive? Allergy or sensitivity to naloxone, uncorrected hypoglycemia. What is the treatment for naloxone in opioid toxicity medical directive? Route, SC, IM, in dose, 0.8 mg max single dose, 0.8 mg dosing interval, 10 minutes max number sign of doses, 3. Route, IV dose, up to 0.4 mg max single dose, 0.4 mg dosing interval, immediate max number sign of doses, 3 *. What is the classification of naloxone? Narcotic antagonist, diagnostic agent. What are the pharmacodynamics of naloxone? Reverses the effects of opioids including respiratory depression, sedation, hypotension, antagonizes the opioid effects by competing for the same receptor sites, especially the opioid mu receptor, also shown to all three opioid receptors but strongest to mu. What is the onset for naloxone IV? 1 minute. What is the duration of naloxone IV? 45 minutes. After the first analysis in a shockable VSA patient, what are the initial joule settings? 120 joules. After the second analysis in a shockable VSA patient, what are the joule settings? 150 joules. After the third analysis in a shockable VSA patient, what are the joule settings? 200 joules. What is the calculation for the initial joule settings of a shockable VSA pediatric? X2 equals 2 joule per kilogram. What is the calculation for the subsequent shocks joule settings of a shockable VSA pediatric? X4 equals 4 joule per kilogram. What is epiglottitis? Acute airway obstruction caused by marked edema of the epiglottis and other supraglottic structures. What bacteria causes epiglottitis? Haemophilus influenza type B. What are signs and symptoms of epiglottitis? Dyspnea, stridor, dysphagia, copious drooling, dysphagia, adenophagia. What is croup? Also known as laryngotrachea bronchitis. The infection leads to swelling inside the trachea, which interferes with normal breathing, and produces the classic symptom of barking cough. What causes croup? Parainfluenza, influenza A. What is the hallmark sign of croup? Barking cough. What is asthma? Chronic inflammatory disorder of the airways. Inflammation results in hyperresponsiveness of airways, can lead to total obstruction of airways. What are the 4 phases of asthma? Mild intermittent asthma, mild persistent asthma, moderate persistent asthma, severe persistent asthma. What are some causes of asthma? Allergy, bronchial constriction, hypoventilation, tachypnea. What does dyspnea mean? Subjective sensation of difficulty or uncomfortable breathing. What does orthopnea mean? Difficulty breathing lying down. What does paroxysmal nocturnal dyspnea mean? Paroxysms of difficulty to breath at night, during sleep. What does Cheyne-Stokes respirations mean? Irregular breathing, with long pauses up to 60 seconds. What does Kussmaul's respirations mean? Increased rate and depth of breathing over a prolonged period of time. In response to metabolic acidosis, the body's attempt to blow off CO2 to buffer off fixed acids such as ketones. What does Bear's respirations mean? Short episodes of rapid, deep inspirations followed by 10 to 30-second apnea period. What are the pharmacodynamics of aspirin? Inhibits the formation of thromboxane A2, which is a potent platelet aggregate and vasoconstrictor. What are the pharmacodynamics of dimenhydrinate? H1 receptor antagonist, depresses hyperstimulated labyrinthine function, may block synapses in the vomiting center. What are the pharmacodynamics of diphenhydramine? Antihistamine with anticholinergic and sedative side effects. Antihistamines appear to compete with histamine for cell receptor sites on effector cells. What are the pharmacodynamics for naloxone? Reverses the effects of opioids including respiratory depression, sedation, and hypotension, antagonizes the opioid effects by competing for the same receptor sites, especially the opioid mu receptor, also shown to all three opioid receptors. What are the pharmacodynamics for nitroglycerin? What are the pharmacodynamics for salbutamol? Selective B2 stimulation, greater than bronchodilation and some degree of vasodilation, some B1 effect, especially with repeated doses, little or no receptor stimulation. What does Beck's triad indicate? Cardiac tamponade. What makes up Beck's triad? Low blood pressure, jugular vein distension, muffled heart sounds. What does Cushing's triad indicate? Indicates that brainstem herniation is imminent. What makes up Cushing's triad? Irregular breathing, widening blood pressure, bradycardia. What causes the Bessel-Gerish reflex? Right inferior infarctions. What makes up Bessel-Gerish reflex? Hypotension, bradycardia, apnea. What makes up Samter's triad? Asthma, sinus inflammation with recurring nasal polyps, aspirin sensitivity. What is caused by Samter's triad? Aspirin exacerbated respiratory disease. What cc would you set the suctioning for an infant? 100 to 150 cc. What cc would you set the suctioning for in pediatric? 200 to 250 cc. What cc would you set the suctioning for an adult? 500 to 550 cc. Define hypoxic drive. What is pursed lip breathing? A breathing technique designed to make your breaths more effective by making them slower and more intentional. You do this after inhaling by puckering your lips and exhaling through them slowly and deliberately, often to a count. What does 1 on the pH scale mean? Very acidic. What does 14 on the pH scale mean? Very alkalotic. What is the renin-angiotensin system? A hormone system that regulates blood pressure and fluid and electrolyte balance. What happens in the renin-angiotensin system when renal blood flow is reduced? The juxtaglomerular cells in the kidneys convert the precursor prorenin into renin, and secrete it directly into circulation. What happens after prorenin is converted into renin, and secreted into circulation? Plasma renin then carries out the conversion of angiotensinogen, released by the liver, to angiotensin I. Angiotensin I is subsequently converted to angiotensin II by the angiotensin-converting enzyme found on the surface of vascular endothelial cells, predominantly those of the lungs. What does